Options with Aflac and Dr. Black's Eye Associates Dry Eye Center of Excellence. Dr. Jessica Pugh is joining me now, and I'm looking forward to this topic because I did not realize the issue. Dr. Pugh, welcome, first of all, to Wave 3 Listens.
Thank you. Thank you for having me.
I want to talk a little bit about this Dry Eye Center of Excellence. 25 million Americans suffer from dry eye.
Yes, it's amazing. It's amazing. We see it every day, all day in clinic. So.
And I'm curious now, what exactly is dry eye? I mean, I know that's a very broad question, but what exactly is it?
Well, it will present in many different ways with patients. They'll come in, probably the most surprising is they'll say, I don't have dry eyes, my eyes are watering all the time. Watering is actually a very common sign of dry eyes. Your brain thinks that the eye is dry, so it starts making tears, but they're very thin, and it just keeps making more. They don't coat the eye very well, so you just end up making more. But people will come in saying they've got something in their eye, scratchy, gritty feeling, feeling like there's sand in there. A lot of people confuse dry eye with allergy symptoms even. So
I'm curious, can dry eye be painful?
Absolutely, absolutely. I had one guy have me dig around in his eye because he was convinced there was something in there, and it was just dry eye, so very common.
Well, that's what's important, I think, about your Dry Eye Center for Excellence, because it's not just about treating the pain. To you, you want to get to the bottom line of what's going on. How do I treat really the problem, right?
Absolutely. It is a really good time for us as a profession. We, for years, have not really had a lot of options as far as treatments go. We've only had really artificial tears that we would say, here, why don't you try this, and use them when it hurts or use them when you can't see. Fluctuating vision is another big sign of dry eye, feeling like it's clear sometimes and then 15 minutes later you can't read anymore. And so it's wonderful for us now to have these tests that we can do to determine what the underlying cause of the dry eye is, and then take the results of those tests and actually apply that to the treatment that we would like to use on each particular patient.
Interesting. And technology has come a long way, because I think a lot of people in the past would live with dry eye, and I can't imagine how miserable that must be. Now you can treat it successfully. Tell me about some of the new technologies and research and things that are going on with dry eye.
Absolutely, yeah. Well, one of the most exciting things that we have now is something called LipiFlow. It's actually one of the issues that we've recently started focusing on as a profession is meibomian gland dysfunction. The kind of basic reasoning for that is the glands in the eyelids that produce the oily layer for your tear film. That is what actually keeps the tears on the eye. So the oily layer is very, very important. If you don't have that, they evaporate quickly and your eyes start watering. So the oily layer that is produced, it's produced in those glands. When those glands clog up, which they're bound to do over time, you get a decrease in that oily layer. So the LipiFlow, what it actually does is it treats the meibomian glands for 12 minutes on each eye, from the inside, heating the glands from the inside and then massaging them from the outside for 12 minutes. So you get up to a year of lasting relief from this.
Wow. So this is great innovation for those who have suffered with dry eye.
Yes.
I love it. What exactly causes dry eye? I know sometimes when people get older, it can just be a part of aging.
Yes, yes. That's probably the number one thing that we see in clinic is age. Gender can play a role in it. Females are much more likely to have dry eye than males, although in the aging population, they kind of catch up. Men catch up, but premenopausal, menopausal, postmenopausal women end up kind of being a guaranteed dry eye patient. So refractive surgery, even cataract surgery to a certain extent for the initial post-op period, but previous refractive surgery, contact lens wear. If you've worn contact lenses for years, eventually most people know you get to a point where you can't wear them anymore. So
how successful are treatments? I mean, when you see someone, are there some you say, well, we can't help you, or the majority of the time, can you help patients?
Most of the time, there's at least something that we can do. There are many supplements. I am religious about taking mine. Unfortunately, a lot of times it's not something that we give them and the next day or the next week they're feeling better. A lot of times it's something, drops that they'd have to use twice a day every day for 6 to 8 weeks, sometimes up to 3 months before they start feeling better. So, but there are great options now that are very effective.
Well, you know, I was looking at your bio, and it's impressive. And but they said all of your peers consider you and your patients peppy, energetic. You are that, and they said genuinely concerned. I'm compassionate. Does that describe you?
Well, I try to be. I try to be. One of my roles, I guess, or one of my job descriptions at the office is I see most of our post-operative patients, but then also if we have patients that are a little disappointed or feel like their expectations weren't met after cataract or refractive surgery, I tend to try to meet with those people and talk through, you know, what could be going on. And I mean, I would say at least 90–95% of the time dry eye is playing a major role in where the expectation has fallen short. So.
And the Dr. Black's Eye Associates Dry Eye Center of Excellence is a family business. Your husband's a surgeon, your father's a surgeon.
Yes.
Interesting.
Yes. No, I'm not a surgeon, but they are.
But, yeah, but you're a doctor. You're
yes.
an optometrist.
Yes, I'm an optometrist.
Okay, so interesting. How do you like that? I mean, I would think that would work well as far as everybody knows each other. It's got more of a little bit of a family feel, which is okay when you're going through something like this. It's kind of nice to have that kind of relaxed atmosphere.
Absolutely. We love it. It's very, very fun. Everybody always is surprised that my husband and I work together. I think, like you said when we were talking before this, we don't do the same thing, and so there's no competition at all. I love being able to see his patients the next day. I love being able to work with my dad and learn from my dad. He's been in the business forever, it seems like, and we've learned so much from him. So it's been fun. My brother gets a little annoyed. He's a soccer coach and a teacher, so he gets kind of annoyed when we start talking the business, but the rest of us love it. So.
Well, if you suffer from dry eye, or you have a loved one, a family member who suffers from dry eye, then let's put the information up on the screen. What's the first step then, Dr. Pugh? What do they need to do? Give you a call? A consultation? How does it work?
Absolutely. Just give us a call and we'll get you in for a consultation. They usually run a series of tests to determine if the dry eye is present and what the underlying cause is to kind of determine where to go from there.
All righty. Again, Dr. Black's Eye Associates Dry Eye Center of Excellence. They specialize in it, and if you suffer from it, this is the place you need to go in Jeffersonville, Indiana. Doctor, thank you for being with me.
Thank you very much.
Appreciate it. It's been fun.
All right. Yes. Thank you.
All right.